So Michelle, what would you say were probably the three main points when you're developing a comprehensive treatment plan for a patient?
Thanks, Charlie. So importantly, holistic wound assessment, that's essential when it comes to planning how you're going to treat your patient holistically and the wound. And then secondly, what's your goal? What do you want to achieve from this plan? It's really important to have a goal in mind. What kind of treatment objectives do you have in mind? And then thirdly, which is really important, is communication with your patient. It's a two-way process, and we need to empower patients to be partners in care. So it's really important to have that clear communication with your patients.
Absolutely. And with regards to that partnership, that really is a very important thing. You need to have your patient on board with what you're doing, and they need to fully understand what it is you're doing and why you're doing it. And if you are able to have those open lines of communication, that trust grows between patient and healthcare professional, and the patient feels more enabled in their care if they are well communicated with. But I think to touch on your treatment goals, absolutely we need to know what it is that our plan is for that wound. Are we going to be able to heal this wound, or is this wound something that we're just going to have to manage the symptoms of? Absolutely, we want to heal all the wounds that we deal with, but sometimes there will be wounds that we can't. So it's about managing the expectation of that wound and whether we can get it to heal, and also managing the expectations of those patients.
Yeah, and to touch on what we were talking about before about empowering patients and the importance of communication, are patients able to help us to follow pathways of care, such as shared care, for example?
Absolutely.
Can we empower our patients to be able to have a dressing change in between the nurse meetings or the nurse visits?
Yeah.
Really important to be able to encourage people to be able to do that where they have capacity. Maybe carers have got capacity to be able to do that as well. So in addition to a shared care pathway, we can also look at other pathways of care. So an antimicrobial stewardship pathway can help to support decision making around infected wounds or wounds at risk of infection and how we treat those wounds. So it's really important to consider how we can not only empower our patients, but use best practice and evidence to be able to support how we treat them.
And can you tell me a little bit more about what antimicrobial stewardship is?
Yeah, so antimicrobial stewardship is a decision-making tool, or the pathway is a decision-making tool which will allow clinicians to make decisions about the wound bed, the wound edge, the peri-wound skin, and the holistic conditions of that particular patient. So the risk factors to being predisposed to having an infected wound, for example, so such as diabetes, chronic heart disease, can impact on the risk factors for infected wounds. But also as well, it helps to manage, it helps to implement a management plan for infected wounds. So if you have a patient who has got a wound that's infected, you can reduce that healing time by following the steps on the pathway. So for example, applying an antimicrobial dressing, or if a patient has a systemic infection, do they then need consideration for antibiotics?
Brilliant. So pathways really are there or designed for nurses, an easy step-by-step guide to follow for, if we use the AMS pathway, wounds that they may think are infected or trying to prevent infection.
Absolutely. And the added sort of benefit to everyone with a pathway such as that antimicrobial stewardship pathway is the potential reduction in antibiotic use, which can then have an impact on antimicrobial resistance or antibiotic resistance in communities.
Brilliant.